Wow, looks like someone's been doing their homework. You sent us a ton of research on external beam radiotherapy for thyroid cancer. So
Yeah.
let's break down these medical journal excerpts and figure out the most important points about using EBRT. For different types of thyroid cancer, of course.
It's a really complex topic, but,
Yeah, right.
if you can understand the nuances, it can make a big difference.
For sure. Before we get into EBRT itself, can we just do a super quick recap of the types of thyroid cancer we'll be talking about? So we got
Yeah.
well-differentiated, anaplastic, medullary, and thyroid lymphoma. They all behave differently, so that obviously impacts how EBRT is used.
Exactly. What's fascinating is that EBRT isn't always the first line of defense. It really depends on the type and stage of the cancer.
Right. Okay, so let's start with the most common type, well-differentiated thyroid cancer,
Yeah.
or WDTC. The excerpts say that surgery is usually the first step, followed by radioactive iodine therapy, sometimes called I-131, and then T4 therapy.
All right.
For those who don't know, what exactly is T4 therapy?
Well, basically, it's taking a synthetic thyroid hormone to replace what the thyroid would normally make. And that helps regulate your metabolism after you've had thyroid surgery.
Got it. Thanks for clarifying.
Yeah.
So where does EBRT fit in for WDTC?
Well, there are some situations where EBRT becomes crucial. For instance, if there's what we call macroscopic residual disease after surgery, meaning there's visible tumor that couldn't be removed, EBRT is often recommended.
So it's kind of like a safety net to get any lingering cancer cells.
Exactly.
Yeah.
And it's also really important for people at higher risk of recurrence, like older patients, or those with more aggressive types of cancer. The excerpts highlight a study where EBR significantly improved 10-year survival rates in older patients with extrathyroidal extension, which is when the cancer spreads beyond the thyroid gland. It increased from 65% to 81% survival.
Wow. That 81% is really impressive. EBRT makes a huge difference in those cases.
So-
What about if someone's already had surgery and other treatments, but the cancer comes back in the thyroid bed or lymph nodes?
Even then, EBRT can still be effective to control it. And it's important to know that having EBRT doesn't prevent future surgeries. So it's not like you're closing off any treatment options down the line.
That's good to know. The excerpts also mention something called intensity modulated radiation therapy, or IMRT.
Right.
What's that all about?
This is where it gets really interesting. IMRT is a more modern technique, and it delivers radiation with incredible accuracy. It's like a high-tech sniper rifle for cancer cells.
Yeah.
And because it's so precise, it can really reduce damage to the surrounding healthy tissues, leading to fewer side effects.
That's incredible. No, we should acknowledge that there can be side effects from EBRT, even with IMRT.
Of course, the excerpts mention some common side effects, like skin irritation, which can feel like a sunburn, and mucositis, which is basically inflammation in the mouth and throat. But the good news is these are usually temporary and manageable.
Right. And in the big picture, they might be a small price to pay for the potential benefits of EBRT. Now, you mentioned that EBRT isn't one size fits all, so let's look at how it's used for bone metastases in WTC.
Right. Bone metastases are a serious complication. And unfortunately, radioactive iodine, which is usually very effective for WDTC, isn't as successful in treating bone metastases. So that's where EBRT comes in.
Oh, so it's a backup plan when radioactive iodine doesn't work.
Precisely. Research suggests that combining EBRT with radioactive iodine is the best approach for bone metastases that can't be surgically removed, or if there are multiple metastases. And it's worth noting that doctors very carefully adjust the radiation dosage when treating spinal bone metastases to protect the spinal cord, which shows the level of care and precision that goes into these treatments.
That makes sense. Okay, so we've covered WDTC and bone metastases. Let's move on to anaplastic thyroid cancer, or ATC. What do we need to know about EBRT in this context?
ATC is very aggressive, and complete surgical removal, which would be ideal, is rarely possible. So in these cases, EBRT is used to control the disease locally and prevent those difficult, uncontrolled neck tumors.
The excerpts did mention that the prognosis for ATC is generally poor.
Yeah, that's true, unfortunately, but there is a small group of patients with what we call limited extrathyroidal extension, meaning the cancer hasn't spread too far beyond the thyroid. And they may actually benefit from a combination of surgery, EBRT, and chemotherapy.
So there's still hope for those individuals. Are there any specific EBRT techniques that are particularly effective for ATC?
Yes. The excerpts mention hyperfractionated radiotherapy. This involves giving smaller doses of radiation more frequently, which may improve local control of the disease, although more research is needed, and in cases where a cure isn't realistic. EBRT can play an important role in palliative care.
Right, so for patients who aren't doing well or have metastatic disease, palliative EBRT can help relieve symptoms and improve their quality of life. Okay, so we've tackled WDTC and ATC. How about medullary thyroid cancer, or MTC? Where does EBRT fit in there?
Again, surgery is the main treatment for MTC, usually a thyroidectomy to remove the thyroid, and a lymphadenectomy to remove nearby lymph nodes. But, just like the others, there are times when EBRT is an important consideration.
Like when surgery can't completely remove the tumor.
Exactly. EBRT can be used as the primary treatment in those cases. It can also be used as what we call an adjuvant therapy. That means it's given after the main treatment to minimize the risk of it coming back, especially if it has spread beyond the thyroid and into the lymph nodes.
Okay, so EBRT is helpful in those more difficult situations.
Yes, but here's a really interesting thing from the excerpts. While adjuvant EBRT improves local control of MTC, it doesn't necessarily increase survival rates.
Why is that?
The excerpt suggests it's probably because microscopic disease, which is too small to be detected by imaging, may have already spread beyond the area being treated with EBRT.
Oh, wow. So it can control the visible tumor, but it might not catch those tiny hidden cancer cells.
Precisely. This highlights how important it is to talk to your doctor about your individual situation. Because while EBRT might control the tumor in your thyroid, other treatment approaches may be needed to address potential microscopic spread.
That's really important. It just goes to show how complex cancer is and how we're always learning more about how to manage it.
Before we move on to the last type of cancer you sent research on, I have to ask, we've talked a lot about the benefits of EBRT, but are there any long-term side effects we haven't touched on?
Yeah, that's a great question. It's definitely important to think about the long term. While most acute side effects from EBRT are temporary, there is a small risk of developing what we call late side effects, and those might not appear until months or even years later.
Oh, wow. Like what?
Yeah. One potential long-term side effect mentioned in the excerpts is hypothyroidism. Radiation can damage healthy thyroid tissue, so some patients might need to take thyroid hormone replacement medication for the rest of their lives.
So it's like the T4 therapy you talked about, but it could be a permanent thing. Right. Another potential long-term effect is fibrosis, which is basically a thickening or scarring of the tissues in the treated area. And sometimes this can cause discomfort or difficulty swallowing.
This is so fun.
It's definitely something to talk to your doctor about. But it's important to remember that these late side effects are relatively rare. Most patients tolerate EBRT very well.
That's good to hear. I imagine the benefits outweigh the risks, especially when we're talking about treating cancer.
Absolutely. It's always a balancing act, weighing the potential benefits against the potential risks.
Yeah.
But, advancements in EBRT techniques, like the IMRT we talked about, have really reduced how often side effects happen.
That's reassuring.
Okay.
We've covered WDTC, ATC, and MTC. Ready to talk about that last type of thyroid cancer, thyroid lymphoma.
Let's do it. This one is interesting because it's treated a little differently than the others.
Yeah. From what I read in these excerpts, surgeries is mostly used to diagnose it, not for the main treatment.
You got it.
Yeah.
Surgery helps doctors get a biopsy so they can confirm the diagnosis and figure out the specific type of lymphoma.
Got it. So where does EBG fit in?
Well, it depends on the type and stage of the lymphoma. For slower growing, or what we call indolent lymphomas, like malt lymphoma, EBRT alone might be enough to control it.
Okay, but for more aggressive lymphomas, the kind that grow and spread quickly.
Right. We usually use a combination of EBRT and chemotherapy, often with what's called the RCHOP regimen.
You mentioned that earlier. What does that mean?
Sure. RCHOP stands for the different chemotherapy drugs in the regimen. Rituximab, cyclophosphamide, doxorubicin, vincristine, and prednisone. They basically all work together to attack the lymphoma cells in different ways.
So it's a multi-pronged attack.
Exactly. And research shows that using EBRT with RCHOP is really effective for treating aggressive thyroid lymphomas.
That's great. I remember the excerpt said that EBRT is very good for thyroid lymphoma overall.
Yeah. It has excellent local control rates.
Yeah.
Which is encouraging.
It seems like EBRT is a really valuable tool for all these types of thyroid cancer, especially when combined with other treatments, like surgery, radioactive iodine, or chemotherapy. Is there anything else about EBR that stood out to you from the excerpts?
What I find really striking is how much this field is constantly changing. We've come a long way from conventional radiotherapy to highly targeted approaches like IMRT, and new research is always coming out.
Yeah, it's amazing.
Like the excerpts mentioned stereotactic body radiotherapy, or SBRT. It's an even more precise form of radiation therapy. It delivers high doses to a very small area, usually in just a few sessions.
So it's like a super focused beam of radiation?
Exactly.
How would they use that for thyroid cancer?
Okay, so imagine a patient with a small recurrence of thyroid cancer in the lymph nodes. Instead of using conventional EBRT, which might affect a larger area, you could use SBRT to precisely target that recurrence
Mm,
and spare the surrounding healthy tissue.
that sounds very promising.
It is, but like any new technology, it's still being studied. And that's what's so exciting about this field. There's always something new to discover and explore.
That's true. This deep dive has been fascinating. I feel like I understand EBRT and its role in treating thyroid cancer so much better now.
Me too. I think it's important to remember that even though we covered a lot of information today, this is just the beginning. There's so much more to learn. Keep researching and asking questions.
That's great advice. You know what they say, knowledge is power. The more you understand about your options, the better decisions you can make about your health. It's amazing how far we've come in treating thyroid cancer. I bet there are even more amazing discoveries on the horizon.
Oh, absolutely. And that brings us to the big question. With all these advancements in EBRT, how might its role in managing thyroid cancer evolve? Could it actually become a more common primary treatment option in the future?
That's interesting. I mean, if we can target cancer cells so precisely and minimize side effects, it's not crazy to think that EBRT could be used more upfront.
Exactly. And with all the ongoing research into new radiation techniques and therapies, we might see a shift in how we treat thyroid cancer.
It's exciting to think about. This deep dive has given me a lot to think about.
Yeah, and remember, this is just the start of your exploration. There's a ton of information out there about EBRT and thyroid cancer. Keep digging and stay curious.
Great advice. A huge thanks to you for sharing your research with us. This conversation has been so interesting.
It's been my pleasure.
Well, listener, I hope this deep dive has given you a better understanding of EBRT and how it's used to treat different types of thyroid cancer. Remember, knowledge is power. The more you know about your options, the better decisions you can make about your health. Keep exploring, keep asking questions, and until next time, stay curious.